Hello everyone. Today I will be presenting on the topic of global health. My name is Ameer Ali. Over the next few minutes, we will explore what global health means, why it matters, the challenges it faces, and the future directions we need to consider. By the end, you should have a clear understanding on how health issues transcend borders and why global cooperation is essential. In this session, we will cover five key learning objectives. First, to understand major global health challenges and trends. Second, to differentiate between global health and international health. Third, to explore key initiatives and interventions that have shaped global health. Fourth, to analyze how social determinants influence health outcomes. And finally, to identify possible future directions in global health policy and innovation. These objectives will guide us step by step through the presentation. Global health is a relatively new but increasingly important concept. The Institute of Medicine defines it as health problems, issues, and concerns that transcend national boundaries, may be influenced by experiences in other countries, and are best addressed by cooperative solutions. This definition emphasizes two things. First, that diseases and health risks do not respect borders, and second, that solutions require international collaborations. Good example is the COVID-19 pandemic, where global cooperation was essential for vaccine development, sharing information, and controlling spread of disease. Let's compare this with international health. International health focuses on the interconnected health status of people worldwide and efforts to improve health across countries. While global health emphasizes cross border issues, international health often focuses on helping low and middle income countries to improve their healthcare systems. For example, malaria control program in sub-Saharan Africa are considered an international health effort, while climate change is more of a global health concern. A historical example is smallpox vaccination program, which was coordinated global effort that led to eradication of smallpox in 1980s. To summarize, the distinction is clear. Global health looks at the problem that transcend borders, such as pandemic, antimicrobial resistance, or climate change. International health, on the other hand, is more about improving health within specific countries, particularly LMICs, and supporting cross border collaborations. So, we think of COVID 19 is a global health issue, but efforts like malaria eradication or TB control in Africa are better described as an international health issues. Both are important. The scope and focus differ. Global health declarations. One of the most influential movements in the global health history was the Alma-Ata Declaration in 1978. It was established at the International Conference of Primary Healthcare. Declaration recognized health as a fundamental human right and identified primary healthcare as key to achieving health for all. Stressed community participation, intersectoral collaboration, and equity. This declaration influenced later health policies, including today's Sustainable Development Goal. It remains a foundation for the idea that health must be inclusive and equitable. In year 2015, the United Nations adopted the Sustainable Development Goal as a part of 2030 agenda. There are 17 goals in total, but several directly relate to health. SDG 3 specifically focuses on ensuring healthy lives and promoting well being at all ages. Other goals like zero hunger, clean water and sanitation, and climate action also impact health outcomes. The SDGs broaden the vision of global health beyond just medical care, linking it to poverty reduction, environmental sustainability, and equity. Major global health challenges. Now, what are the major challenges we face in global health? Infectious disease remain a huge concern. HIV, AIDS, malaria, TB, and multiple diseases like COVID-19 at the same time. Non-communicable diseases such as diabetes, cardiovascular diseases, and cancer are rising rapidly. Maternal and child health is another critical area with high mortality in LMICs. Finally, environmental health issues like air pollution, climate change, and water scarcity pose global risk. These interconnected challenges make global health complex and demanding. As you can see in this global map, infectious diseases are not confined to one region. Outbreaks spread rapidly, and controlling them requires international data sharing and cooperation. Between December 2022 and January 2023, data showed widespread infections globally, reminding us how surveillance and timely reporting are essential. For example, WHO's COVID-19 dashboard allowed countries to track and respond more effectively to the pandemic. These graphs highlight global COVID-19 data collection between December 24, 2022 and January 23, 2023. COVID-19 is a clear case of why global health matters. No single country could stop the pandemic alone. Collaboration on vaccines, research, and response strategies was essential. At the same time, inequalities in vaccine access showed us the gaps in global health system. COVID-19 has taught us valuable lessons about preparedness, equity, and the need for stronger international cooperation. The rising burden of non-communicable diseases. While infectious disease remains a threat, non-communicable disease or NCDs are now the leading cause of death globally. Cardiovascular disease is number one killer worldwide. Diabetes affects over 460 million adults and cancer claimed nearly 10 million lives in 2020. The challenge is that low and middle income countries still lack access to early diagnosis, preventive care and treatment. As lifestyles changes, urbanization and unhealthy diets drive these numbers higher. Addressing non-communicable disease required not just medical solutions but also policies to promote healthy living and reduce risk factors. This chart shows regional trends in cardiovascular disease, death rates from 1990 to 2019. We can see that while high-income countries have managed to reduce death rates during prevention and advanced healthcare, low and middle income countries continue to carry the highest burden. This highlights the inequality in healthcare resources and why global action is needed to ensure that life-saving interventions reach everyone, regardless of where they are. Maternal and child health. Maternal and child health remains a global priority. Currently, the maternal mortality rate is 211 deaths per 1 lakh live births globally, with most of these deaths occur in developing countries. In 2019, about 5.2 million children under 5 died, often from preventable causes like infections, malnutrition, and lack of timely health care. The biggest challenge are the shortage of skilled birth attendants, poor healthcare infrastructure, and in access to services. Improving maternal and child health is not only about saving lives, but also about breaking the cycles of poverty and improving long term development. Social determinants of health. Health is not only determined by medical care. Social determinants, the condition in which people are born, grow, live, work, and age, play a huge role. Poverty limits access to healthcare and nutritious food. Education influence health outcomes. Higher education linked to better health literacy and practices. Housing and environment affect disease transmission, especially in crowded conditions. This means improving health requires a whole of society approach, not just clinical solutions. Policies must target these root causes to truly improve global health. System strengthening. Strong health systems are the backbone of better health outcomes. This means investing in healthcare workforce, improving infrastructure such as hospitals and clinics, and ensuring sustainable financing. Rwanda provides a great example where community-based health insurance has helped increase access and affordability. Without a strong health system, even the best global health initiatives cannot succeed. Strengthening these systems also improve preparedness for emergencies like pandemics. Health system strengthening. Universal health coverage or UHC means that all people can access quality healthcare without financial hardship. It is a central goal of World Health Organization. However, achieving UHC is not easy. Barriers including inadequate funding, weak infrastructure, and lack of political commitment. Yet, benefits are enormous. Healthier populations, reduced poverty, and more resilient societies. Thailand, for example, achieved UHC in 2002, proving that even middle income countries can make this vision a reality. The right policies and priorities. Key global health organizations. Several organizations play a vital role in global health. The World Health Organization leads initiatives, set global standards, and coordinate international responses. UNICEF focuses on child health and nutrition. Gavi works to improve vaccine access, particularly in low-income countries. The Gates Foundation provides significant funding for global health research and programs. Each of these organizations has its strengths, but together they form a network that drives progress in global health. Success stories in global health. Despite challenges, there have been incredible success stories. The eradication of smallpox in 1980 remains one of the greatest achievements in public health history. Rwanda reduced maternal mortality by 77% through investment in healthcare. Thailand's achievement of universal health coverage in 2002 showed that bold policy decisions can transform health systems. These examples remind us that progress is possible when there is commitment, collaboration, and innovation. What we can do moving forward. First, we need increased funding for global health initiatives. Second, advocacy. Advocacy for health equity is essential to ensure that no community is left behind. Third, supporting global health programs and policies helps build healthier societies. I would like to end this quote. Health is a human right, not a privilege. This powerful statement underlines why global health must remain top priority for all nations. Digital divide, gap between haves and have nots. One of the hidden but critical global health challenge is the digital divide, the gap between those who have access to technology and information and those who do not. In today's world, access to information is almost as important as access to medicine. Countries with stronger internet infrastructure can collect health data, support telemedicine, and spread health information quickly. On the other hand, many low and middle income countries struggle with poor connectivity and limited access. Inequality means millions of people are left behind when it comes to health innovations. Closing this divide is essential if we want truly global progress in health. Now let's discuss mental health as a global health priority. Globally, about 1 in 4 people will experience a mental health condition in their lifetime. Mental health is now recognized as a major global health issue, yet it remains highly neglected, especially in low and middle income countries. The link between mental health, poverty, and exposure to violence is very strong. Each one worsens the other. Stigma also prevents people from seeking care. Without investment in mental health services, we cannot achieve holistic health for populations. Prioritizing mental health means breaking cycles of poverty and suffering while building resilience and well being in communities. Innovations in global health. Fortunately, innovations offers hope. Mobile health or mHealth, expanding access to care in remote regions through simple phone based tools. Telemedicine allows doctors to consult patients across distances, breaking barriers of geography. Artificial intelligence and big data help predict disease outbreaks before they spread. Vaccine development and distribution strategies are improving, as we saw during COVID 19. Community based interventions such as local health volunteers ensure sustainability. These innovations shows that solutions don't always require huge resources. Sometimes it's about using what we have more effectively and equitably. Health policy and advocacy in global health. Policies and advocacy shape global health outcomes more than we sometimes realize. Organizations like WHO, World Bank, and NGOs play central roles in setting priorities and mobilizing resources. International agreements such as Paris Agreement on climate change also directly affect health. Advocacy is a powerful because it raises awareness, influences policymakers, and ensures that health remains a top priority on global agenda. For example, strong advocacy has helped secure commitments to universal health coverage and funding for vaccines. Policies and advocacy are therefore just as important as science and medicine in improving global health. The future of global health. Looking ahead, what does the future hold? Pandemic preparedness and response must be improved. COVID 19 showed us both the strength and weakness of our current systems. Climate change will continue to shape health outcomes and will require urgent attention. Expanding universal health coverage worldwide remains a key goal, ensuring that people everywhere can access essential services. Finally, we must address ethical concerns in biotechnology and genomic medicine, ensuring that advances benefit everyone fairly. The future of global health will depend on how well we can combine science, policy, and equity to create a healthier world. One important point to remember is that global health challenges are diverse. Some professionals focus on infectious disease, others on non-communicable conditions, but no single discipline can solve these issues alone. Interdisciplinary approaches are essential. For example, combating climate health related threats like collaboration between doctors, environmental scientists, engineers, and policymakers. Similarly, addressing maternal mortality requires not just healthcare providers but also social workers, educators, and community leaders. The burden of disease can only be reduced when multiple disciplines work together in harmony. Thank you for your attention. We have covered a broad journey today from understanding the definition of global health to looking at key challenges, successful initiatives, innovations, and future directions. The big takeaway is this: health is shared responsibility. Disease don't respect borders, and neither should solutions. Together, through collaboration, innovation, and commitment, we can create a healthier and more equitable world. Thank you.